Okay, well, again, thank you all for joining us today for this webinar on Psychiatric Advanced Directives, Empowering Control over Mental Health Care. We're delighted to welcome Jamie Haley, who's with the UI Health, Department of Health, Social Work, and Psychiatry. A little background about Jamie. She graduated from the University of Minnesota with a degree in child psychology in 2004 and in MSW from Jane Addams College of Social Work from UIC in 2010. She's worked as an inpatient psychiatric social worker on the adult inpatient psychiatry unit at UI Health since 2010 as a part of the psychotic thought disorders treatment team. During her time at UIC, she's received several care-based awards. In 2016, she was named UI Health's Employee of the Year and received the 2020 University of Illinois Award of Merit. Her area of interest and expertise is in mental health law, and she frequently provides education and consultation around topics such as advanced directives, involuntary commitment and treatment, and utilization of various programs such as CIT, officers, AOT court orders, and writs. In December of 2021, she developed and launched the UI Health Outpatient Psychiatric Advanced Directive Clinic, which continues to empower individuals through education and assistance with completion of psychiatric advanced directives. So we welcome her here today. And just as a side note, this is being recorded. We'll share this with our all of our members so you can share it with your board and staff. We'll also share the slide deck afterwards so you can share that as well. So if you do have questions throughout, you can raise your hand or post in the chat and we'll monitor that, and Jamie will answer it as she's able to. So with that, please welcome Jamie.
Thank you so much, Jody. Hopefully everybody can hear me okay. I'm really excited to be here and talk more about psychiatric advanced directives. I feel very strongly that they are an underutilized resource. So I'm hopeful that by continuing to talk together about these, that we'll be able to increase awareness and use of them to empower patients. So to start out, what is an advanced directive? Most basic. An advanced directive, as you guys may already know, is an advance written statement expressing a patient's wishes for future medical decision-making. And it's a document that must be honored by healthcare providers in the event of patient incapacity. Now, in this discussion, I'm going to be talking primarily about psychiatric advanced directives. For medical treatment and care, there is a surrogate decision maker hierarchy under the Illinois healthcare surrogate law, and it's not for individuals with psychiatric needs, and it doesn't pertain to psychiatric care. So surrogate decision makers can't admit to a psychiatric facility or consent to non-medically emergent psychiatric treatment. There's special laws that govern psychiatric care. Aside from an individual having capacity and making fully informed decisions on their own, which is always ideal, there are two types of self-designated advanced directives that help to guide treatment for providers when someone's not able to do that. There's the power of attorney for mental health care, or just the power of attorney Illinois short form, which the most up-to-date form includes all medical and mental health care. There's also the Declaration for Mental Health Care, which is the psychiatric advanced directive that we'll be talking most about today. And that is the really underutilized resource and form that I was talking about. And I think primarily because so many people don't know that it exists. And if they do know it exists, it's hard to figure out kind of where to start with how to connect patients with them. And then I also include, when I talk about advanced directives, even though guardianship, adult guardianship, is not a client chosen advanced directive, It is a court-designated directive, and it guides care in much the same way as power of attorney and declaration for mental health care does, in that it designates an alternate decision maker. So I always include it in discussions of advanced directives, but specify that it is the one court-designated directive that providers must honor and follow. So just a little bit first about each of the different advanced directives. Guardianship, again, is the court-ordered directive. It determines that a person is incompetent and therefore they can't make decisions without a fully informed competent agent. So just a reminder that competency and capacity are two different things. So competency is a global assessment and legal determination made by a judge in court. Capacity is a functional assessment and clinical determination about a specific decision that can be made by an MD familiar with the patient's case. So whereas competency doesn't wax and wane, once a court order is placed that you are not competent and you need an adult guardian, though you may not need guardianship in the future, competency is in place even when individuals are not unwell or in the hospital. It is deemed for the time period that guardianship is in place that this individual needs assistance with decision making at all times. Whereas capacity waxes and wanes quite frequently and can be dependent on the individual decision being made. So in order to have an adult guardian assigned to you by the court, a report of physician must be completed and accompany an individual's application to obtain adult guardianship over their loved one. So an MD always has to make an assessment that they agree that someone is in need of this decision-making assistance. The decision-making agent is then appointed by the court and is either the petitioning interested party, like a loved one, a parent, an adult child, or if a decision maker is needed and someone's deemed by the court to be incompetent, then they may be assigned a state guardian if there's no one that is able to take on guardianship for them. As I said, it's always in effect until there's a termination of the guardianship by the court. So, once that guardianship is granted, it's always in effect, and it's assumed that an informed decision maker is needed for medical decision making. And the powers of guardianship are limited to serving as a voice for the patient by carrying out decision making based on known or perceived patient wishes or best interests. And that's the reasons for that is that it protects the individual's rights. Like we said, this is not an advanced directive being laid out. These are not wishes of the patient being laid out by them. This is assigned by the court. So, in essence, they're saying that this individual cannot understand the treatment that is needed. They can't understand the large scale decisions that need to be made, and they need an alternate informed decision maker who then needs to work as that individual's voice. They have been deemed by the court to be able to understand those large decisions, but must act how they believe the individual would so choose it within their best interests. Powers of guardian are limited by law and do not include involuntary admission to a mental health facility, administration of psychotropic medications if the patient is actively objecting, or residential placement if the patient is actively objecting. So again, the decision maker is serving as the individual's voice. So as long as the person under guardianship is assenting to the treatment that the informed decision maker is granting permission for, then that's great. But if they are actively objecting or have different wishes than what is being granted permission for, then the mental health court has to step in and oversee, and we have to go through involuntary paperwork for that treatment if it's still necessary. And then in order to maintain guardianship, a guardian must provide an annual report to the court for guardianship. And I always remind people that initiation and maintenance of guardianship can be costly and time consuming. So, sometimes, it can be easy for us as providers to say, so-and-so really needs a guardian. How come their daughter doesn't become their guardian? How come their mother doesn't become their legal guardian? It's not the most easy process, and it can be expensive. It can be hundreds of dollars for the fees up front to file guardianship paperwork. And then you have to maintain it and pay those fees each year and, go to court each year. And so it can be challenging for individuals to have somebody that's able to maintain that. Are there any questions about guardianship? The next one, advanced directive I want to talk about is power of attorney for healthcare. So this is appointed by an individual at a time where capacity is determined to be intact, to decide, I want so-and-so to make healthcare decisions for me when I can't. This includes treatment for any medical or mental health condition. It was not the case historically, but the most up-to-date power of attorney for healthcare forms in the state of Illinois includes treatment for all medical and mental health treatment. It designates a decision-making agent who must agree to the appointment. They must agree to be the individual's decision maker. And it affords all decision-making power to the agent, including admission to a psychiatric facility and decision to accept treatment for the duration of time that the individual is incapacitated until the individual revokes the POA document. So whereas guardianship, the guardian's decision does not override the decision of an individual who is actively objecting. Power of attorney for healthcare, because the individual self-designated this, and it is assumed that the individual had full capacity to say, I want so-and-so to make healthcare decisions for me when I cannot. When they completed this document, it holds more power, and that when the individual's not well, and this goes into effect, the decision maker can override the individual, even if they're saying they don't want the treatment at that time. And another difference that I didn't note on here, but probably should note, is that guardianship, again, it's court ordered and it's always in effect until the court terminates it. The power of attorney for healthcare is only in effect when an individual is deemed to be incapacitated. Otherwise, they're their own decision makers. So the power of attorney for healthcare can be revoked at any time, in any way, regardless of mental state or decision-making capacity. So this is where it kind of gets tricky. The power of attorney itself designated and therefore holds decision-making power. The agent holds the decision-making power, even if the individual is actively objecting at the time that treatment is needed. However, an individual can then revoke the power of attorney regardless of their current mental state. And that is a protection there for the individual. And what we would need to do as providers then is to channel any treatment needs at that time through mental health court. So none of these provisions mean that an individual cannot receive treatment that they need. It just dictates where the decision-making is being channeled. So in this case, if someone were to revoke their power of attorney, even when they're ill, they have the right to do that. And then we would have to go through our typical process of involuntary commitment and involuntary treatment if that was needed. This document doesn't expire unless it's revoked. So once it's signed, it's in place unless it's revoked. And then when the individual regains capacity, at that point, they'd be able to redo the document and do another one. But otherwise, the power of attorney does not expire. And again, it's only in effect when an individual is lacking decision-making capacity. Any questions about power of attorney? So we talked about guardianship and we talked about the regular power of attorney for healthcare decisions. Because psychiatric care is structured under separate laws under the mental health code, there are special protections and special forms that are needed in order to help navigate the decisions that come along with psychiatric care. A psychiatric advance directive in the state of Illinois, you'll frequently hear it referred to as a declaration for mental health treatment. That's our most current form. And it's a legal document that allows individuals to document wishes for future psychiatric treatment. So it's similar to a power of attorney, but it's solely for psychiatric care and decisions. And there are 3 sections to it. An individual, when they complete this, consents or does not consent separately to psychiatric medications, electroconvulsive therapy, and admission to a psychiatric facility for up to 17 calendar days. So those are the 3 separate sections that they are consenting to and that are discussed with them at the time of completing this form. So psychiatric advance directives, or PADs, were created as a result of several court cases from the 1970s and 80s that focused on patient self-determination regarding medical and psychiatric care. And these same cases led to the Patient Self-Determination Act of 1990, which kind of drives today's standards when it comes to advance directives, in particular psychiatric advance directives. And that's the federal law that requires Medicare and Medicaid providers to ask whether the patient has an advance directive and to inform the patient of their right to complete an advance directive. I know here at UI Health, we as social workers do that in the health social work department, and we also have our pastoral care providers who also have that discussion with individuals when they come in. So the parameters of a PAD. So a PAD differs from a regular power of attorney for healthcare in that it's appointed by an individual at a time where capacity is intact to decide, I want so-and-so to make mental health care decisions for me when I cannot, in accordance with these specific guidelines and wishes regarding my mental health care. So whereas there's a lower level of capacity needed for assigning a power of attorney for healthcare, you just need to know, I want my mom to make decisions for me when I'm not well. When you complete a PAD for each of the 3 sections that we talked about, you need to know that you want that person to make decisions for you, but you have to have the capacity at the time of completing this to state your specific wishes in advance about the 3 different things that we pointed out earlier. And so it's a higher level of capacity necessary when completing. And accordingly, a higher level of credence is afforded to the document at time of use. So for someone with psychiatric needs, this really is the most powerful document in a number of ways. It's powerful for the individual. It's an empowered state of written state of their wishes. And it's powerful for the providers in that these very specific wishes were assumed to be completed when an individual had a high level of capacity and laid out specifics for their treatment, and therefore can only be revoked when someone is well. And, even if they're actively objecting at the time that they're deemed not to have capacity and ill, then their wishes on this and the decision maker that they appointed overrides that objection. And this document, whereas a power of attorney doesn't expire once signed, this must be reaffirmed every 3 years. So it's another protection, another reason that this document has so much power is that an individual is not only laying out the very specifics of what they want as far as their health care, they're continuously reaffirming these wishes and making sure that they're current and up to date. So a PAD is only in effect when an individual is lacking decision-making capacity. And the state of Illinois requires documented determination by 2 physicians, and one must be an attending physician. And I just put on here the part of the code that states a determination that an adult patient lacks decisional capacity shall be made by the attending physician to a reasonable degree of medical certainty. And this document can only be revoked or adjusted when an individual is determined to have decision-making capacity to make that decision. And it must be revoked or adjusted in writing. So whereas a power of attorney can be revoked at any time, regardless of mental state, and in any way, verbally, I think the code states, verbally, if it's torn, if it's set on fire, basically any way that it's made known that the power of attorney is to be revoked, it's revoked. Psychiatric advance directive, it takes into consideration the current mental state of the individual, and has to be revoked or adjusted in writing when they're well. Any questions about those parameters? So what does a psychiatric advance directive include? It includes treatment only for mental health conditions. So whereas the power of attorney short form includes all medical and mental health decision-making, a psychiatric advance directive is solely for psychiatric care. So it is frequently a good idea for individuals to have both, to have a power of attorney completed and a psychiatric advance directive completed. The form designates a decision-making agent who has to agree to this appointment. And this component, though, and I always stress this in the clinic we have here, is not mandatory for an advance directive to be completed. It is ideal that an individual has a support that is supporting them and is able to serve in this capacity. But if they're not, it's not mandatory for an advance directive to be completed. I would just stress that the individual at time of completion should be very specific with their wishes, since this is the sole document that we're going to be looking at for their wishes for treatment. And any deviations from that are not going to be able to go through an alternate decision maker. We're going to have to go through a mental health court. And we want to try to avoid that. We want to empower individuals to, and part of that is avoiding involuntary treatment. Even though a psychiatric advance directive overrides objections when someone's not well, it's assumed that this individual, when they completed this, these were their sound wishes. So, it's not the same as involuntary treatment. Involuntary treatment, we don't know if these were the wishes of the individual, and we're having to go through legal avenues to pursue the treatment. So we want to make sure that there's enough in here that we're able to utilize the document without the decision-making agent. And then I just put in here the wishes have to be carried out as stated in the document. Any deviations from written wishes or addition of treatments have to go through mental health court, like we discussed. affords all decision-making power to the agent that is assigned for the duration of the time that the individual is incapacitated, and treatment decisions must be in accordance with the patient's documented wishes and directions.
Jamie, we had a question.
Yeah.
Yeah.
It's a good question. Do the documents need to be notarized? No, they do not. And that's something we'll touch on a little bit later. They did used to be. They used to have to be notarized. They no longer do, which is a good thing in that it is more accessible for providers to offer these and for individuals to complete these, but it also may be seen as a negative because there's not someone kind of overseeing an individual's, not someone else who is overseeing this other than the individuals who are helping the person complete the advance directive. So how is the psychiatric advance directive completed? I'm hoping that because you guys are here and talking about these things with me today, that more of you are looking to complete psychiatric advance directives, or at least offer some education to individuals regarding psychiatric advance directives. So I wanted to guide you a little bit through how they're done. So the most current declaration for mental health treatment has to be completed and signed in the presence of 2 witnesses. And below is what's on the most current form, the affirmation of the witnesses. So in my clinic here, people come to me and I go through psychiatric advance directives with them. But I'm not the only person who is witnessing them sign. The 2 witnesses have to be individuals who know of the individual and that they're familiar with, but can be no part of their care team, cannot be relatives, cannot be associated with them in any way. When I started the PAD clinic here, I consulted with Marvin Schwartz, who runs the National Resource Center for Psychiatric Advance Directives through Duke University, regarding, what I was thinking and how I was working to set up the clinic, and his thoughts on utilizing for witnesses individuals who are not part of the treatment, but are office clerks. So individuals who are familiar with the patients, and that they're checking them in, they're calling them to schedule appointments, they know of them and they're here when they sign the documents, but they're not part of their treatment in any way. And it was determined that that is the best avenue in this setting. So that's who we utilize here for witnesses. After that, an individual has to express understanding of notice to person making a declaration for mental health treatment. So when someone comes in, I verbally, and I give them a copy to read through as well, but I always verbally go through this all with them, and make sure that they understand the document that they're signing and that they're here of their own accord to sign this. And that, everybody's on the same page before moving forward with any sort of documentation. Following that is the first of the 3 sections for consent. And the first section has to do with psychotropic medications. And, an individual has to decide if they consent to the administration of psychotropic medications, or they consent to administration of only specific psychiatric medications, or if they do not consent. And there's place is there for them to list any conditions, limitations, any medications they may have been on before, anything at all. Someone asked in the chat, what is the cost of state guardianship? I think the cost of filing for state guardianship currently is almost $400. So it can be quite pricey after all of the documents are filed.
We also had another question about who's allowed to serve as a witness.
Yeah. So the people that are allowed to serve as a witness are individuals who are familiar with the patient. So they have had some sort of interaction with them before, but they are not actively involved in any sort of treatment or care. They're not partners, they're not relatives, or known like personally to them. So it can get tricky to find appropriate witnesses. So who we utilize here are the two of our clerks here frequently assist me with the Psychiatric Advanced Directive Clinic. They're able to be here on the days that I do the clinic. They're able to witness the signatures, and they are only familiar with the individual in that they check them in, they speak with them to coordinate the appointment, and they're here and know that they're coming here and actually meeting with me and completing this documentation. So that's who we utilize here. The second section for consent is for electroconvulsive treatment. And they separate this from the other treatment from psychiatric medications in its own section. If I become incapable of giving or withholding informed consent, either you consent to the administration of electroconvulsive treatment or do not consent to the administration of electroconvulsive treatment. And then again, conditions or limitations can be listed there. And I know frequently, especially if they're individuals where this is a treatment that has never been brought up to them before, it can be daunting to see it here. And so I really do some more explanation around this section in that, you know, electroconvulsive therapy and treatment is only for specific conditions and specific patients, and it's a treatment that is discussed heavily with your treatment providers ahead of time and is only done with an individual's consent. Just to kind of answer any questions they might have about that, or you know, beforehand, because it may not be a treatment that was brought up for their particular condition before. Doesn't mean that it won't be a treatment that is on the table later, depending on their condition. So I want them to be able to ask as many questions as possible about it and to express their wishes on it after asking any questions. And then the third section is admission to and retention in a facility. So whereas guardianship, they can't consent to admission in a facility, power of attorney and a psychiatric advance directive can. So for the psychiatric advance directive, they have to state if they consent to being admitted to a healthcare facility or if they do not consent, and again, can list conditions or limitations. And the decision maker that they've granted is the person that is then signing them into the hospital when needed, and serving as the voice and decision maker for the individual. The next section on the Psychiatric Advance Directive is the appointment of that trusted person. It's referred to as an attorney in fact, and it's the decision maker that's being granted in this document, if someone's available to serve as that person. And then, after that, we identify who that person is, then that person has to accept in writing that appointment as the attorney in fact. So they agree to accept this appointment and serve as this person and make decisions for this individual in their best wishes and, accordance with their wishes as much as possible. And then additionally, on this document, directions can be provided, including a selection of physician to be one of the two physicians who will determine whether the patient is lacking capacity. So if you recall, two physicians need to determine that someone is lacking capacity in order for this document to go into effect. And you can list a physician that you want involved in this decision making if you choose. So a lot of times individuals here will come from our clinic and they have a trusted outpatient provider that they'll frequently want to list here as an individual who's included in that decision making. And individuals can also specify additional instructions or conditions, whatever those may be. I've had people put all sorts of things on there, including things like, they want to note on there that they have pets. And so if they come in incapacitated and this document goes into effect, it's a document that, we have on file here. They want it noted on there that they have pets so that when we pull this document and we're utilizing it, we can make sure to notify their decision maker to care for their pets that they're at the hospital. A lot of different things, and they really can add anything that they find pertinent to their care. And then the form is finalized by the principals or the individual's witnessed signatures. So again, it has to be witnessed by two witnesses who are not involved in the patient's care and are not like personally known or personal relatives of them. On the final page on this document, there's a separate revocation page included in the document. An individual can always revoke or make adjustments to this document, but whereas the power of attorney can be revoked at any time, regardless of current capacity, revocation or adjustment of documented directions in a psychiatric advance directive can only occur at any time that the patient is not determined to lack decisional capacity. So they have to have capacity at the time that they revoke it or make any changes to it. And then an individual upon completion of this should always be given the original document because it's a legal document and they'll need to have that original. And then I usually provide one copy in addition to the original to the individual. And then a copy should be kept on file if you're completing it through an agency where someone receives mental health care. It should be kept on file for continued treatment guidance and then reaffirmed every 3 years. Any questions about that piece and how to do a psychiatric advance directive? So good question. So when is it appropriate to offer or inform patients and families about psychiatric advance directives, and how should it be done when it's not a standard practice? So I recommend that this is a discussion whenever you see patients and whenever you see new patients in particular. I think it should be more of a standard practice to bring up and discuss the option of psychiatric advance directives and make sure that people are informed that they're an option to be signed and that they're out there. So I would say anytime is a good time, anytime that you deem an individual that you work with to be able to understand that information and have a discussion about it, I think it's a good time to have that discussion. Hopefully that answers your question. So what are the benefits of
Amy, I have a question. I just want to clarify something.
Yeah.
So you said, like a power of attorney, they can be revoked at any time, no matter the patient's capacity, whether they're on the psychiatric unit or not.
Right.
But a declaration for mental health treatment can only be revoked when the patient is determined to be well. Is
Yes.
that right? Okay.
That's correct. Yeah. And that is because there is a higher level of capacity necessary when the individual completes the document. And so it kind of holds more power because they had a high level of capacity when they completed it and understood that piece and specifically consented to that, you know, the different pieces separately.
Mm-hmm. Great, thank you.
Yeah. The benefits of psychiatric advance directives include empowering control over mental health care and treatment, prevention of involuntary treatment, which can be, though necessary at times, can be really traumatic for individuals if they haven't played a part in the decision making around their care. It can be traumatic, and we really want to maintain positive relationships with individuals and you know, work together with individuals to make the best treatment plan for them and include them in the decision making as much as possible. These forms enable loved ones to be better and more informed advocates, and they make preference of care clear and easy to prioritize for providers. So there's a higher level of capacity needed when they're completed. It lays out specifics about wishes, and it just makes it easier for providers. It's not a guessing game. When you have this form, the individual, while they were well, laid out their specific wishes about these things. And so it's clear and concise and easy to follow. It's a good question. Do psychiatric advance directives apply to teens or only adults? Right now, you have to be a legal adult in order to complete a psychiatric advance directive. And that is because, and let me specify, you have to be a legal adult who doesn't have their current adult guardian. So basically, anybody under guardianship is deemed not competent to be able to sign a form like this. So someone who is not an adult and has a legal guardian in that manner cannot sign a legal form like this. And someone who is over the 18 and a legal adult but has been deemed by the court to need a guardian for larger scale decisions like this can also not sign a form like this. So if someone already has a legal guardian assigned to them, they can't sign a psychiatric advance directive. They may be able to later if they are no longer under guardianship or adult guardianship and the court has deemed them to now not need that and be competent to make decisions. Then at that time they can sign this. But anybody under a guardianship cannot sign this form. The clinical implications of psychiatric advance directives. Well, number one is the prevention of involuntary treatment and subsequent reduction in length of hospital stays awaiting court. The current average amount of time patients await court for involuntary treatment in Illinois currently is 2 to 3 months. The court is extremely backlogged, and you know, if individuals come to our unit and we have to file that, you know, they need treatment, they can't safely be discharged, it's determined they can't safely be discharged without treatment, and they don't have an advance directive in place, and we have to go through mental health court, it can be really lengthy. And during that time, they're not receiving treatment. They're in the hospital, so they're in a safe place, but that's detrimental to them not being able to receive treatment for that amount of time. And a study by Wilder and colleagues found that patients who specified a medication in their psychiatric advance directive were more likely to continue with that medication 12 months later. So it's been shown in studies that, individuals are more likely to continue with treatment after they receive care, even if you're utilizing the psychiatric advance directive and they may be not well and actively objecting at the time. After capacity is regained, they're more likely to continue with the treatment and medication 12 months later than an individual who also was not well at the time, and we had to go through the court process in order to get them the same treatment, and they regained capacity just like the other individual, but it's been shown that they're then less likely to continue with these, this treatment that help them regain their capacity. There are a lot of barriers currently to completion and utilization of PADS, which is why we're talking about this today. There's a lack of consumer and provider awareness that these forms exist and education around them. There's, even if providers know about them, there's a lack of provider time to complete them and resources to be able to meet with individuals to complete these and to be able to keep them updated and things like that. There's a lack of assistance with the completion and or explanation of forms. So, providers might know that these exist, but don't quite know, how to get them started or how to complete them. There's a current lack of mechanism for determination of competency when completing. So that can be a barrier because, the individual is able to do these, does not have to do them, in front of a physician, does not have to do them in front of an attorney. Just does the forms with someone who may be able to guide them, or even some people do them on their own. They go somewhere and they have separate individual witnesses. There's no current standard for determination of competency upon completion of the form. There is, when the form is being utilized, two physicians have to determine capacity, but there's no current mechanism when they're signed. There's also no current monitoring system in the state of Illinois for any advanced directives, basically, but POA and guardianship included. But in particular, this is important for psychiatric advanced directives because they have to be updated every 3 years. And there's no current statewide monitoring system. Individuals complete them, and if they complete them here or at another agency and the agency keeps them on file, and they'll know of them. Otherwise, the individual has to present them to, the agent has to present them to each subsequent provider. Care Everywhere helps a little bit with that, Epic, as long as they get scanned in and they're able to be viewed by subsequent providers, so that helps. But there's still, not a lot of people, not everybody is in Epic yet. And providers have to be aware of how to go looking for that. So those are barriers right now. The form is time limited, so it has to be updated every 3 years. And so, there's frequent opportunity for that to lapse. And there's no current requirement or formal process for determination of capacity, like we talked about, upon completion. And the potential for psychiatric advance directive wishes to deviate from standard practices is there. But we talk a little bit about, in the next slide, about deviating from the PAD instructions. So providers can refuse to implement PAD instructions only due to conscientious objection. So let's say an individual specifies, like, I only want this medication at this time for this. Maybe, it doesn't clinically make sense as far as standard of care, for example. If it's something that a provider thinks may be harmful to an individual, they can not provide that care due to conscientious objection. If they feel in good conscience that it can't be authorized without compromising safe care, but the individual has to provide clear and concise documentation of why the provision of the advanced directive can't be safely implemented, why they're deviating. And they have to remember that if one provision of an advanced directive cannot be safely authorized, it doesn't invalidate the whole form. All other provisions must still be authorized. So if an individual gives has specific wishes around medication that maybe can't be safely authorized at the time that this psychiatric advance directive is in place, but they have other specific wishes about electroconvulsive therapy or admission to and retention in the hospital. Those other things, as long as they're safe and they follow safe standards of care, those must be carried out. So it doesn't invalidate the entire form. And then 3 exceptions to, if you have this form in front of you, 3 exceptions to the wishes on this form. As we discussed before, obviously if the provider cannot safely follow the instructions, but also providers can provide treatment contrary to wishes expressed in the PAD in an emergency, can still be involuntarily admitted regardless of express wishes in PAD if emergency criteria for involuntary hospitalization is met. So if an individual does not consent for psychiatric admission in their PAD, that does mean that whoever they designated as their decision maker cannot sign them into the hospital. But if someone is very ill and needs hospitalization and it's not safe for them not to have hospitalization, they can still be admitted, but the avenue to which they're admitted to the hospital would be through mental health court and involuntary admission. And then a provider can provide treatment contrary to wishes expressed in a psychiatric advance directive if the wishes are contradicted by a court order. So any court order supersedes the psychiatric advance directive. So if someone completed a psychiatric advance directive, they needed treatment, the treatment they listed in their psychiatric advance directive was not safe, the provider determined that mental health court avenue was needed because they could not follow the psychiatric advance directive, and the court agreed with them and then put in a court order for alternative treatment, then that is the document that would then be followed, the court order. Court orders always supersede any sort of psychiatric advance directive. Any questions at all about that? So I just wanted to give, and by giving the information here for the UI Health Psychiatric Advanced Directives Clinic, they opened this clinic in December of 2021. It's a monthly clinic, first Monday of the month from 1 to 4, and we do 45-minute appointments, and it's here. Currently open to individuals who are interested in obtaining information and completing psychiatric advance directives. This is the first kind of 3-year period that I'm doing this clinic. So right now we've been keeping it more closed to individuals here at UI Health while I continue to collect data and hopefully work to expand this a bit. And it's an opportunity to discuss and complete psychiatric advance directives. So individuals can come here and just gather more information. They can come here for multiple appointments if they want. They can bring their loved ones, and I can go through and complete the psychiatric advance directives with them, and then get them into our system here and inform outpatient providers. So we're trying to get a more streamlined system here for individuals who receive care at UI Health. And then just to note that the most recent forms for all advance directives can be found on the Guardianship and Advocacy Commission page. So that's where I recommend that you go if you want to complete the forms with someone, and print the forms off there because they keep them up to date. And those are my references. Does anyone have any questions? Or I'm hopeful that you guys will take this information and hopefully want to utilize more psychiatric advance directives in your own clinics and practices.
Well, thank you, Jamie. This was wonderful and very informative. I know there were some questions about the slide presentation. We'll send that out to our members. I know there's a few that aren't ACMHAI members on here, so I'm not sure if you'll be able to send them to your own network. But then we'll also have our, we have a YouTube page. ACMHAI has a YouTube page, and so we will upload this presentation on there as well, and then send out a link to the archived recording to our members. So, but yeah, appreciate this. Is very informative. Thank you so much. Let me see if there's any final questions. Website for recent forms. I think you covered that, right? I think there we go.
Yeah, the Guardianship and Advocacy Commission, if you go to their page, they list all of the most up-to-date forms.
And somebody's asking about CEUs. We don't provide CEUs, but I'm not sure if that's something through you, through you, Jamie, if you're able to do something like that, or.
I can look into it. I know that it's one of the health social workers here, so I can talk with them here about options.
Okay, great.
Great, thank you.
Thanks, everyone. Thanks for joining us, and take care. Enjoy the afternoon.
Have a good day.
You too. Bye-bye.